The last few weeks, COVID-19 cases have surged in Asia, particularly the Hong Kong, Singapore and Thailand. While the population in these countries are witnessing increased hospitalization, India sees a mild uptick. Also, according to the health officials quoted by the PTI, India stands at 257 cases and is monitoring the situation with increased vigilance. As per the preliminary information available, the cases are mostly mild, not associated with the unusual severity of the mortality, the officials have said. Also, spike in the COVID-19 cases in the Asia, Hong Kong, Singapore, Thailand and even China have reported an increase in the COVID-19 cases over the past few weeks because of various factors. According to the Singapore's health ministry, the estimated number of the COVID-19 cases in the week of April 27 to May 3, 2025 has also rose to 14,200 cases compared to 11,000 cases in the previous week. Over the same period, the average daily COVID-19 hospitalization rose from 102 to 133, but the average daily intensive care unit, that is ICU cases, decreased from 3 to 2 cases. The hospitals are currently able to manage the increase in cases, a report by the Singapore's health ministry mentioned. Also, in Thailand, the cases spiked to 33,000 between the May 11 and May 17, with at least 6,000 cases in Bangkok, according to the Department of the Disease Control. Similarly, in Hong Kong, there was an increase of COVID-19 cases from 6.21% to 13.66% in just 4 weeks, that is April 6 to April 12. After the resumption of normalcy, Hong Kong experienced cycle of active periods of the COVID-19 in every 6 to 9 months, said Dr. Edwin Tusi, the controller of the Center for the Health Protection. Also, between March 31 and March 4, the number of people testing positive for COVID-19 in China went up, according to data from the Chinese Center for the Disease Control and Prevention. Among patients with flu-like symptoms also visiting the clinics and emergency rooms, the positivity rate rose 7.5% to 16.2%. Also, for those admitted to the hospital, it increased from 3% to 6%. In Thailand, the XEC variant, a strain of the Omicron, has led to an uptick in the cases. This could also be attributed to the Songkran holiday period, that is from April 13 to 15, during which the cases numbers have steadily increased. But what is causing these spikes? Let's see. As per the Singapore health authorities, the rise in the cases is attributed to the waning immunity in the population and the spread of the new variants, also L5N7. The LF7 and the NB1.8 is also the descendant of the JN1 variant, which emerged back in the 2024. This means that the protection from the previous infections or vaccination is gradually decreasing over time. Due to this, the virus can spread more easily, particularly among the high-risk group like those above 65 years of age. Besides this, the seasonal factor that is increased, also the social gatherings and the travel could also have been contributing to this massive surge.